Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Methimazole. Right. Methimazole is actually the drug of choice for Methimazole is the drug of choice for hyperthyroidism. It is the drug of choice for amiodarone induced hyperthyroidism. It is also the drug of choice for Graves' disease. Methimazole has a side effect. If you give methimazole in the first trimester, it can cross the placenta and can cause teratogenic effects in the fetus. So it can cause aplasia cutis and also it can cause esophageal atresia in the baby. So methimazole is not used in the first trimester, but it is the drug of choice for second and third trimester of the pregnancy.
thank you and thank you for watching.